Hey there, this is Doug Dowler with the Mathis Economic Development Corporation. I'm here today with Dr. Acuña. We're so glad to be having a new Mathis Health Clinic here in Mathis, and we're here to find out a little bit about what the health clinic's about and why we need healthcare services here in Mathis. We're so excited, Dr. Acuña. You're here, you've got the clinic open. Tell us a little bit about the process we went through to kind of get the clinic here.
To kind of give everybody a little bit of feedback, Doug approached me about 6 or 7 months ago asking to help out with a health clinic here in Mathis. Unfortunately, rural health or rural areas are losing health care left and right, and unfortunately it's not being replaced when the providers leave. So we have been working together over the last 2 or 3 months and have come together with a plan, and we've managed to open a health clinic, a family health clinic, to make sure that the area does have at least family health care here. And we have been able to do that with the work of several people in the community, including Grace Lutheran Church, which donated funds as well as their building to be converted into the clinic. And over the last 6 months we've managed to do that. We have opened a clinic about kind of a soft opening about 6 to 8 weeks ago. And now we're getting ready to have an open house next week, and we hope everybody comes and will help support the clinic, because the more support we have, the more services we'll be able to offer to the clinic, or to the staff here. Not the staff, but to the people of Mathis.
So Dr. Acuña, you're from this area here, grew up in Sinton.
Correct.
Over there. How have you seen healthcare change over the last few years?
Just to kind of give you an idea, I started in Sinton. I opened my practice here after practicing a year in Houston, and I could not take the big city. So I came back home. I went to high school in Sinton, started in '86. When I started in '86, there were 6 other doctors in Sinton. There were 4 doctors in Taft. There was a doctor in Odom, and I think there was 3 doctors here in Mathis. Today, there are only 2 full-time doctors in Sinton to cover the same amount of territory and population that all those physicians covered back in '86. Mm-hmm. And as a result, it's kind of put the people in the rural area in a hardship as far as seeking medical care, because now everybody has to drive 30 miles to go, even for a simple cold, get care for. So we're trying to establish this clinic in hopes of not only providing medical care, but maybe trying to lure another young doctor into the area so that he can stay and keep the clinic going.
Good. So you've got it open now for about 6 weeks. Tell us a little bit about the staff and who you've got there.
Well, we currently have a good staff. We brought on a new nurse practitioner, and we're hoping to convince her to stay here full time. The staff that we have currently are also from the area. They're locals, so they have just as much interest in keeping the clinic going and providing the services as anybody else.
Mm-hmm. So you've done this before. You've opened up a clinic and started. What did it mean to you to be able to have a facility like this that's basically turnkey? You walked in and you could start opening up your practice.
Well, it's very nice. It takes a little bit of the stress off of dealing with getting the physical plant ready. Part of the problem with the rural health area losing health care is young doctors are not encouraged to come to the rural area, and there's several reasons. One of the setbacks is that a lot of the young doctors that are graduating already owe $150,000, $200,000 in loans, and to start up a clinic from scratch, you're looking at $250,000 to $300,000 to get it going. Mm-hmm. And then you got to wait 6 months for income to start coming in. And these young doctors just can't wait. Mm-hmm. They have loans to pay off. They have family to support. So a lot of them are going to medical groups or corporations so they can get a guarantee and start paying off their loans. So something has to change to incentivize these young guys to come out here and start practicing in a rural area. Mm-hmm. And really, I think, once they get out here, I think they would enjoy the type of medicine that they can practice out here versus being told what to do in a corporate setting.
So what's your vision, or what's your future for the Mathis Health Clinic, kind of in your mind?
Well, right now we have the clinic open. It has 4 exam rooms, and we do, basic health care. We are not an emergency room, but we're there to help take care of the people and direct them to wherever they need to be directed to. But in the future, we're hoping that we can, obtain some funds where we can start providing services which include x-ray, bone density, sonograms, basic things that we can do here in the clinic and here in the town, so that people don't have to drive 35 miles to get the procedures done.
Okay. Well, Dr. Acuña, again, welcome to Mathis, and thank you so much for taking an interest in helping Mathis provide good quality health care, something that we haven't had here in a while. And we certainly look forward to a very successful run of the Mathis Health Clinic here.
Okay.
That's why we want to call Mathis home now. We have our health clinic, we have our community, and we're growing. So thank you.
All right, good to be on board.